All of you get confused with the arterial supply of the stomach. Let's understand it today once and for all, but conceptually and logically. Let's start from the basics. The abdominal aorta, as we know, has three major branches. The celiac trunk, superior mesenteric and inferior mesenteric arteries. The celiac trunk supplies the foregut, superior mesenteric supplies the midgut, and the inferior mesenteric supplies the hindgut. Now, the celiac trunk divides into three major branches, one for each major foregut organs: liver, spleen and stomach. So for the liver you have the common hepatic artery, for the spleen you have the splenic artery, and for the stomach you have the left gastric artery. So we have already got our first artery supplying the stomach, that is the left gastric artery, directly coming from the celiac trunk. Remember one important fact about the arterial supply to the stomach. The stomach receives blood supply from 5 major arteries, 2 pairs and 1 set of short gastric arteries. What are the 2 pairs? Right and left gastric and right and left gastroepiploic. Now the logic is left-sided branches come from the left-sided vessels, right-sided branches come from the right side. So, left gastric, as we saw, directly comes from the celiac artery. Now what is left? Left gastroepiploid. It comes from the left branch, that is the splenic artery, and the short gastric also comes from the splenic artery. Let's move on to the right side. The major artery on the right is the common hepatic artery. So the right gastric arises directly from the common hepatic, while the right gastroepiploid comes from the gastroduodenal branch, which is a branch of common hepatic. Understood? Now, if you found this little detail useful, that's exactly how I teach inside my infusion course. For every concept, for every detail, and for every small thing. I don't just tell you what to remember, I explain you why it is that way. If you're in your final year and you haven't started general surgery yet, this is the perfect time to join. We are currently doing hepatopancreatic biliary system, but we will be starting with general surgery very soon in this batch. You can see all the previous lectures recording as well. So join the batch now. The link is in the bio.